between his incisors of 80 to 81 millimeters, and left lateral excursions of 18 millimeters and right lateral excursion of 8 millimeters. The MRI report says the temporomandibular discs are within the condyles bilaterally. I don't know what this means, other than the radiologist who read the report is unfamiliar with TM joint radiology. There is no translocation between the closed and the open mouth positions. This really means there is no translation of the condyle between the closed and open mouth positions, which is highly unusual for a person who can open 80 to 81 millimeters. His tics consist of eye blinking and eye rolling, head jerks, facial grimaces, nose twitching, mouth opening, lip licking, grunting, snorting, and spitting. Whistling, arm extending, touching objects, smelling objects, jumping, skipping, and hopping, tensing muscle groups, making animal-like sounds, unusual voice changes, and self-injurious behavior. Previous treatment he's received is 2 years of orthodontic treatment, multiple neurologists, psychiatric care for the past 11 years. His medications are Tegretol, clonidine, haloperidol, Klonopin, Lovesa, benzotropine, Vistaril, Zoloft, and medical marijuana. Additional treatment consists of a deep brain stimulator implanted 2 years ago, and then a second deep brain stimulator implanted 1 year ago, neither of which has worked. His self-injurious behaviors consist of biting his cheeks, gagging himself, slams the side of his body with his elbows. He tried to gouge out his left eye due to tics and severe pain in the left eye, and was put on a 17-day medically induced coma. This is this patient's frontal head x-ray. Notice the brain stimulator implanted on his left side and the one implanted on his right side. Notice the wires that run from these down his neck into his chest on either side. While looking at this x-ray, observe the overgrowth of his nasal turbinates, which have deviated his septum to his left side, and the misshapen piriform or nasal fossa. This is his patient's lateral skull x-ray. You can see the implanted deep brain stimulators and the wires that go up over the brain and down the head and down the side of the neck into his chest. This is this patient's submental vertex x-ray. You can see all the wiring implanted in his skull. Notice also that one side of his skull is a little bit convex, where the other side is flattened or concave. This is a severe cranial distortion and should be addressed. This is a young male that comes in with Tourette's syndrome. He's got eye blinking tics, head jerk tics, facial grimaces, nose twitching, lip licking, snorting, grunting, spitting, whistling, jumping around, hopping, tensing of muscle groups, grunting, and a half a dozen other tics. He also has a self-injurious tic. You can notice his left eye patch, where he had a tic in the center of his left eyeball that he tried to calm down. This resulted in him being put in a hospital-induced coma for 17 days to heal the area. He's had 2 deep brain surgical stimulators placed in his brain, which have done no good for the tic in the center of his left eyeball. He also has left face pain and left cheek or cheekbone pain. His MRI is negative for TMJ dysfunction. And he comes in wearing a lower splint like this. We'll put this in. Yeah. but it doesn't give him any relief. He wears a dowel here on top of it to increase his vertical, and it is this vertical that gives him some relief and decreases his urges. So today we made him an appliance which we're going to deliver right now, which our starting point, our starting height is going to be the combined height of these two appliances. Like this. So when he concludes down, this is going to be his opening here. He says this diminishes his urges approximately 50%, and that's after just a couple of minutes of the appliance sitting in there. Okay, how's that feel? Okay, do you want to say anything to the viewing audience? Like all that you've been through and things like that?
No.
This is your chance now. You're on television.
Okay, I don't want to be on television.
Oh, he's shy. He's shy. Okay, I'm just teasing.
You're not on television. So.
I know I'm not television.
Okay. We're going to dismiss him now overnight, and he's going to return tomorrow for his first checkup. And we'll show you what his appearance is and the decrease in his tics when we view him tomorrow. Returns after wearing the appliance approximately 24 hours. He felt it was a little bit too low, so I increased the height 2 millimeters on each side, which is the thickness of one tongue blade. You can tell from his countenance that he's already improved in a short period of time. Notice how the patient's head is more upright, that his facial grimaces and distortions have decreased, and most importantly of all, his shoulders have squared off, so his posture has changed. Do you have anything to say to the viewing audience?
No.
You happy with what I'm doing for you?
Yes.
Okay. Thank your father for making it available to you. You owe him big time. Big time.